The Affordable Care Act. Do you want to take that section?
Sure. In 2010, the Affordable Care Act was introduced as a solution to many of the pressing problems of cost and access. The objective of the ACA was to offer access to health insurance to the nearly 48 million people in the U.S. in 2010, unable to get health insurance or good health insurance through employers. The following are a few main features of the law. Millions could purchase health insurance via new government exchanges or obtain coverage through Medicaid, the government-run healthcare program intended for the poor, which many states dramatically expanded via incentives in the ACA. For those who qualify, the government provided subsidies to offset the cost of insurance premiums for plans available for the exchanges. Insurance companies are required to offer health insurance to people with pre-existing conditions on the same terms as others. All would be required to purchase health insurance. Those who did not have to pay a fine, effective 2019. This tax was eliminated when Congress passed the 27 Tax Cuts and Jobs Act. A new tax on expensive employee-provided policies was instituted to control costs. The ACA got off to a rocky start, but has since extended coverage to almost 20 million people, meaning more Americans have access to health insurance. Although uninsured rates are still at all-time lows, the number of uninsured Americans rose for the first time in a decade between 2017 and 2018. This is due to declines in Medicaid coverage as rising wages leave fewer people eligible for Medicaid, and due to the fact that more people are foregoing insurance. Kind of like the people in my clinics that I see, they are the working poor and so do not qualify for government assistance. Since the individual mandate tax was reduced to zero, what's more, the ACA is just not working for many Americans, as the cost of healthcare continues to rise faster than Americans' incomes. The cost for many to buy a health plan, if they don't get it from a job or a government, is higher than ever. More people than ever are uninsured thanks to high out-of-pocket expenses and deductibles. An estimated 44 million people were uninsured in 2018, up from 29 million in 2010. Compared to insured adults with adequate coverage, uninsured adults are more than twice as likely not to fill a prescription, skip a recommended test, treatment, or follow-up appointment, and have medical debt. While opponents of the ACA have not reached a consensus on a replacement plan, several policy prescriptions have attracted widespread support. The ability to buy health insurance across state lines to create more market competition and choice in policies. Secure renewal of health insurance that is guaranteed so people have health insurance can keep it and not see premiums soar if they get sick. Cost transparency so people can know the prices of their insurance and medical services. So for more on the ACA, see in the brief, the Policies Affordable Care Act Deep Dive.
So there's another brief that we have that's really specific around the Affordable Care Act. So do you have like some experience with the ACA and some thoughts here, Lena?
Yeah, there it was. I remember when that was coming through, Sylvie. Do you remember when it was, when Obamacare and ACA was coming through, that the guarantee that if you like your insurance, you get to keep your insurance, and those who were uninsured were the ones that would most benefit from this. But there were some unintended consequences of the Obamacare. One of the things I noticed, my husband's an engineer. We have great private insurance through his company. It's awesome. But our insurance did change because of the Obamacare and the regulations. The cost of providing insurance went up much higher for those on the private insurance markets and the employers. So the premiums went up, the deductibles went up, and they dropped certain types of high cost insurance to find alternative insurances that offered really us less coverage and less flexibility. That was one of the things I noticed. Even though we stayed insured, we never didn't have insurance, But for those who did have insurance, the Affordable Care Act did drive prices up for those. And, I can accept that for individuals who take the hit for individuals that don't have insurance. But I think the other thing that happened, those who did find insurance, especially those in the suburbs through the ACA, couldn't find providers to take that insurance. So just because you have government insurance doesn't mean you can go anywhere or that people are willing to even see you or take that type of insurance because of the payout that government insurance gives to the provider, which is very low for services. And particularly, depending on your specialty, pediatrics, the payout is very low. Since pediatricians typically don't do a lot of procedures where they can bill higher numbers, and in our healthcare system, there is less reimbursement for well care than is for sick care. So as a pediatrician, we're doing a lot of things that deal with keeping patients well and making sure kids are growing well and developing well. And those types of encounters are lowly compensated. So it may make it more difficult for people on these exchanges to even find a provider or a place to go. So you got insurance, but you got nowhere to go. It's really rough.
Yeah. Yeah, I mean that is always a dilemma around the world, right? The availability of practitioners and healthcare. It's the same everywhere in the UK and Canada and France. It's not, they're just not there. It's a really, I feel like the one piece that surprised me in the Affordable Care Act, it was not more flexibility or the ability to form co-ops, for associations, for people to really band together so that they together can create a plan that fits their needs. If you are not planning on having a family, for instance, or you're done having a family, you shouldn't have to pay for maternity care coverage, for instance. You should be able, it should allow for really flexibility and reward health. I mean, I think that's something that's interesting that you say, is that compensation insurance should reward well care instead of just sick care. And that's a piece that's not enough part of the conversation, and to really reform healthcare and focus on the problem, right?
There is an incidence. I know that there are some companies, which is really cool, that put healthcare challenges to their employees.
Oh yeah,
really cool. So, for example, they may have a 5K or a healthy diet thing, and they actually take their blood work, and if they're in certain parameters, they will actually give them a bonus back. So if you're not a smoker, if you're not, so there's some things incentivizing, even companies are doing that, and their employees to incentivize them into healthy living to help drive down some of those costs. So that's been
bringing that up because it's true,
taking
especially with all the wearables and the technology. It's
exactly
to kind of track and these steps to challenge, and that's one thing that technology is really enabling us to do, is rewarding healthy behaviors.